Today is November 18th, 2015. We are in the office of Nurse Susan Kunhardt at Marlboro School. My name is David Holzapfel. On video camera is Soren.
Okay, chop it, let's go. You're filming.
On video camera is Soren Whitehouse. On audio recorder is Cyrus Burt. On still camera is Zanabu McNeese.
You should have a pencil or a pen so you can, like, check when you've asked a question and don't lose track.
Don't wrinkle your paper. Yeah.
I'd like to ask you a few questions about your background.
Sure.
In what year did you move to Marlboro?
I moved to Marlboro in 1974.
Where did you live before here? How did you end up in Marlboro?
I grew up in Massachusetts in a little town outside of Springfield called Wilbraham. And then in high school I moved to Springfield, this bigger city, and I really didn't like it at all. And when it came time for me to graduate from high school, I looked at colleges, and I looked at small liberal arts colleges. And I chose Marlboro College because it was the smallest liberal arts college in the country. And so I came up here to go to Marlboro College in 1974.
What is your street address in Marlboro?
1196 Lower Dover Road.
Would you talk briefly about the history of your house?
Well, my house was built probably 40 years ago by a group of carpenters that were a cooperative of carpenters called Sun Shelter, mostly carpenters in Marlboro. And my husband, Woody Bernhard, oversaw the production of the house. I was not married to him then, but moved into the house once it was done, and about 25 years ago.
What is your husband's name and occupation?
Woody is Woody Bernhard, and he is a carpenter.
What are the names of your children?
I have Margaret Joan Bernhard and Rose Mary Bernhard, and I have a stepson, Pete Bernhard.
Did they attend Marlboro Elementary School?
They sure did.
How old are they now, and what are they doing in their lives now?
Margaret is also known as Maggie, and she's 22 and lives in Brattleboro, and she works at a restaurant in town. She also runs an open mic at a local bar and does a lot of singing and playing the guitar herself. Rose is almost 19, and she is at Smith College in Northampton. This is her first semester. And Pete is 36, and he lives in Putney, and he is in a band called The Devil Makes Three. He's the main composer and lead guitarist and vocalist. It's a great band.
What are the names of their teachers at MES?
Oh boy, well, Pete left Marlboro School, I think, after he had Johnny Esau in 4th grade. So he had Johnny, and he had Mr. Morris, and Connie Barton was the principal. And I don't remember who he had between Mr. Morris and Johnny Esau. But Margaret had Ellen for kindergarten, and it was Judy's first year of teaching here at Marlboro School when Margaret was in 1st grade. So she had Judy and Jody and Johnny and David and Tim and Rachel. And Rose had the same teachers as Maggie did.
Where did you grow up?
Well, I grew up in this little town called Wilbraham.
Oh, yeah.
And it was a great town. We rode our bikes everywhere. We had a great school. I had a lot of fun growing up.
Where did you go to school when you were young?
I went to some elementary schools in Wilbraham. Stony Hill and Mile Tree were the two names of the elementary schools. And then when I moved to Springfield, I went to Duggan Junior High, which was built on an old dump site, so we used to call it Duggan Dump. And then I went to Classical High School downtown in Springfield.
How do you describe yourself when you were a child?
Well, I was the third out of 4 children, so I was a middle child. I wasn't very competitive. I had an older sister who was a great ballerina, and I wasn't a good ballerina. I had a brother. That's a good question. I loved playing with horses. I didn't play with dolls much. I played with horses, so I think I had a great imagination. I loved swimming, and I still do. So I wasn't very competitive. I had a lot of friends. I think I was just a happy-go-lucky kind of kid.
What did you do after high school before you entered nursing school?
Well, I went to college for a couple of years, and I didn't quite know what I wanted to study in school. Marlboro College, you have to declare what your plan of concentration is, and I had been taking literature classes, art classes, science, music, all sorts of things. So at that time, the head nurse at Brattleboro Hospital happened to be the nurse at Marlboro College, and she said, "Why don't you come down and be a nurse's aide at Brattleboro Hospital, see what you think?" So that's what I did, and I really liked what I was doing. So I saved my money, and back then Brattleboro had a year-long LPN, which is Licensed Practical Nurse Program. So I did that from 77 to 78, and then in 1980 I went back to school and got my RN through a university in New York State. So I got my RN in 1980.
What nursing school did you attend?
Well, it was called the Regents College, and it was kind of a distance learning kind of school. You studied a lot on your own and you took exams, and then the final exam was a clinical exam at this huge hospital in Albany, St. Pete's. And it was a 3-day exam, and it was really hard, but I passed. Thank goodness.
Have you done any graduate level nursing study?
No, not really. I've done lots of kind of certificate studies of things that I'm interested in doing, so they were much more appealing to me than like really going back to school and doing all that.
What level of nursing have you attended?
I have my associate's degree in nursing.
How old are you now?
You really want to know?
Well, let's think.
I'm 59.
Very young.
Thank you, Althea.
During your work life, what jobs have you had aside from nursing?
Well, that's a good question. I went to nursing school when I was 22, and so I've been a nurse since I was 22. I think as a young adult I did a lot of babysitting. I really haven't had many other jobs besides nursing jobs.
How did your interest in healthcare and nursing develop?
Well, as I mentioned, I became a nurse's aide at the hospital and just really liked taking care of people and seeing that I made a difference in their life and feeling better and getting healthier. That's a wonderful position to be in when you can really see that someone's getting better as a result of how you're treating them.
Yeah. What are some of the specific areas which you need to know about in order to get your nursing degree?
Well, I think the most important thing is being compassionate and being willing to help people, being empathetic. That really is a good quality to have, I believe. An interest in sciences is really helpful because a lot of nursing and medicine is based on science. Pharmacology, for instance, human anatomy, physiology, learning the circulatory system, then it leads into learning how to do CPR and advanced techniques to resuscitate people.
How long did you have to study to get your degree?
I would say at least a couple of years. My LPN program was a year, and then I did this external degree program. It took me another year to do that for my associate's degree.
Would you give me a brief overview of your nursing career?
Sure. So when I graduated from LPN school, I worked at Brattleboro Hospital on a medical surgical unit and then worked in pediatrics. Then when I got my RN, I worked on the surgical unit and eventually worked in the coronary care unit, the intensive care unit. Then in 1986, I started the outpatient cardiac rehab program at the hospital for people who had had a heart attack or open heart surgery. And it was a program that was an exercise program, an education program, and a stress reduction program. So I had like 70-year-old men lying on the floor meditating. And then they'd get up and do a little jog on the treadmill or ride their exercise bike. It was really a lot of fun. And again, to see people in those 3 months' time that they were coming to the program really getting their confidence back and having their hearts heal was just a great thing. So then I did a lot of other things with nursing. After I left the hospital, well, then I had my babies, and then I went back to the hospital and worked in the recovery room, taking care of people after they had surgery. And then I started working in doctor's offices and at different clinics, and really liked being in the outpatient setting as opposed to inpatient setting. So that's part of, and then I worked at Marlboro College and their health center for like 7 years, and I worked here for a number of years and left for a few years, and then went back again as a school nurse. What I'm doing now currently, is that one of the questions? Is that okay to go there? Is I do elder care, for taking care of an older woman living alone in her home. So she has different caregivers that come in. I've done that kind of care for a handful of women in Marlboro, actually, more at their end of their life, where they needed a little more intense home care. And that was just a beautiful opportunity to be with someone towards the end of their life. My greatest passion, what I'm doing now, is I'm what's called a birth doula. So I assist women. I'm there to support a woman and her partner or family, whatever, during the labor of their baby. And that's really exciting for me. I just love the miracle of birth. It still just amazes me when I see a baby getting born. So that's what I'm working on right now, is building up a business for that. And I work with my cousin who's a home birth midwife, so I've been at some home births and have done a lot of births, assisted women in the hospital as well.
Why have you continued work as a nurse?
It's so satisfying. I mean, I think when you're happy with the job that you do, that's the most important thing, is being happy with what you like to do. And it makes me pretty happy. I really like it.
What sorts of related healthcare opportunities could someone be enveloped in with a degree in nursing?
Oh, nursing, there's so many opportunities at nursing. I mean, there's school nursing, hospital nursing, doctor's office nursing, but it's just, oh gosh, I'm drawing a blank. Let's see. The Department of Health, every state has a Department of Health, and that does a lot of public health education and intervention, and I'm drawing a blank, sorry. There's just, I'm trying to think of others.
Lots.
There's lots of things a nurse can do. Oh well.
Currently, you are nursing for the Marlboro Elementary School. What does your nursing job at the school involve? What are the different parts of the job?
Well, I'm only here 5 hours a week, and most of my work is more administrative.
Mm-hmm.
We have to supply the state with different reports, and so I have to keep a lot of records for that. I do screenings, vision and hearing screenings, not on every student. It's required that they're done on kindergartners, first grade, second, third, fifth, and seventh grade. So I do the screenings.
Mm-hmm.
I make sure first aid kits are available throughout the school and for field trips. I'm a resource for people when there's an outbreak of an illness. I provide education to the staff members about that. But I don't really see a lot of sick kids because I'm really busy doing that. So Gail is really the real school nurse. She's the one that puts on the Band-Aids and takes care of kids most of the time.
Do you have a favorite part of your work with the kids, and would you explain a little bit more about it?
I think my favorite part is when I get a student here one-on-one when I'm doing their screenings, like looking at reading the eye chart or doing their hearing test, because then you can just really spend a little more time with them, get to know them a little bit, just really check in to see how they're doing.
Yeah.
And I think we do a really great job here at Marlboro as a whole team, you know, watching out for every student. So, you know, I feel like I have a voice and some eyes to contribute to that.
Yeah. What do you feel is the most important parts of your work as a nurse in the community?
I think education is a huge part of my work. I think people make all sorts of decisions about their health care, and for me, the best decision is made when that person's really informed. And, you know, I have a lot of information in my head and at my fingertips, so I think providing information and education is really vital for people to stay healthy and make good choices.
Would you please describe a typical day at work in the Marlboro School, from when you get up in the morning till you go to bed at night?
Oh boy. Well, I have it pretty easy because I only work 5 hours that day, so I get up and have a nice breakfast and make my way to school. And I check in at the office and kind of check in with Gail and see what kinds of health trends are going on. You know, a couple weeks ago, most every kid in kindergarten was coughing, so I just would check in with that classroom and see what's going on. She also keeps a log of kids that have come up for ibuprofen for a headache, for instance, or if they've, you know, if there's any trends, if there's a certain student I should really pay attention to if they've been up there a lot, like if they're having frequent headaches, for example. I want to check in with them, make sure I do an eye test on them, make sure their vision's okay. So, and then I usually make my way down to my office after getting my mail and pull out my pile of work and turn on the computer and check email and go from there. I mean, the emails often prompt me to do certain things. If I'm needed, Gail calls me or I have to go up to the office. So I kind of make my rounds and kind of just check in. When we have head lice outbreaks, I do lice checks on everybody in every classroom. Thank goodness we're in a good place right now with that. So it's just kind of getting a sense what's going on in the school that day and then going from there.
Recently you've trained to be a doula. Would you please explain what it means and why you choose to undertake the training?
So a doula comes from an old Greek word meaning woman servant. And so today what a doula means is a support person for a woman in labor when she's having her baby. And that support is physical. You provide different position changes to help her through labor that can relieve some of her discomfort. It's emotional. You're really telling her what a great job she's doing. She's trusting her body. Her body knows what to do. And it's informational support. So if they have questions about what the medical staff might be offering her for an intervention, saying they don't really understand it, then I can provide that information. So it's really supporting in many ways a woman throughout labor. And, you know, the reason I do it is I love it, but, you know, there's nothing better when after the baby's born and the mom says, I couldn't have done this without you. You know, that just is the most amazing feeling, you know. And of course she could have done it without me, you know, but it's so satisfying. It's really very joyful.
What people or experience would you say have influenced you in your work and life as a nurse and a doula? In what ways have they influenced you?
Well, I think back to my early days of hospital nursing, and there were a couple of nurses that were just amazing. The way they talked to patients, the way they treated the patients. I'll never forget their compassion, their understanding. They just took the time. And that's important. That made a big impact on me. And then when I did the training at the hospital, the woman who does the training is so great, and she's really knowledgeable. And, you know, all sorts of women give birth. You know, there's young, there's old, there's people who want a natural childbirth, there's people who want, you know, lots of medications, and you really learn to get your attitude out of the picture.
Yeah.
I'm not the one having a birth. I would make my own choices, and I'm there to support their choices. So I think that she's been a great mentor for me. My cousin, who's a home birth midwife, she's just real brainy, you know, she's so smart about the science behind birth and everything. And she's just amazing to work with because she's so smart and is willing to teach me anything. So I feel really lucky that I've had great teachers in my life.
What are some of the ways the job of nursing has changed you since you got your degree?
Boy, that's a really good question. When I first started nursing and I worked in a hospital, you know, we hand wrote all the charts. Nurses had to have really good handwriting because everybody had to read the charts. Doctors' handwriting is famously, well, you can't read it, it's just terrible. So that was a skill in how to read doctors' handwriting. So we've come a long way in that now all of those records are done on the computer, electronic medical records.
Yeah.
I'm not sure it really saves time or not, because learning how to use these programs is very much time consuming. So there's just that part of daily nursing, the documentation process.
Mm-hmm.
As far as the medical part, there's incredible advances that have been made during the course of since I've been a nurse. You know, when I worked in the ICU, I was there when they first came out with these clot-busting drugs. So if a person came in the hospital having a heart attack, which is caused by a blood clot in a coronary artery, they had to meet certain criteria, and if they did, excuse me, I have to take a drink, sorry. We could give them a drug that would literally bust up that clot and reduce the amount of damage to their heart they were experiencing during their heart attack. And that was just amazing to watch and be part of, seeing these people who probably would have died if they didn't get this clot-busting medication. So the medical advances with different diagnostic tests, excuse me, time out. Sorry. You're going to edit all this out, right?
Yeah.
Do I have this cloth thing? So, different diagnostic tools they've come a long way. They're just amazing with CAT scans and MRIs and whatnot, cancer treatments. There's just so many advances that have been really amazing to be part of witnessing that and working it.
One follow-up question to that is, when you were a nurse at the hospital, was like the kind of situation at the hospital a lot different than it is now?
Well, I'm not quite sure I know exactly what you
Like,
mean.
how they kind of operate with each other to help a patient.
I think it's pretty much the same. I haven't worked there since the early 2000s, and when I worked there, I was in an outpatient program running the cardiac rehab programs. On the nursing floors, it's always been team nursing. There's always been like a team leader and then nurses that took care of the patients.
Mm-hmm.
That still happens.
Yeah. If you could live anywhere in the world without having to be concerned about income, where would you want to live?
Oh, there's no place like home.
Yeah.
I love living in my home. I'd like to visit other places, but I really wouldn't want to live anywhere but Marlboro.
What other activities are you involved in outside of nursing? Hobbies or things you like to do?
Well, I've been involved with the Brattleboro Women's Chorus for 16 years. That's a real bunch of soul food for me. I love singing with that group of women. We have dairy goats, and I like to make cheese and milk my goats and take care of them. And we grow a lot of our own food. We have lots of gardens. Been involved with town stuff. I was on the Marlboro Fair Committee for many, many years. Did the rummage sale after Michelle and Gail stopped doing it. I kind of took over the rummage sale for a number of years. Now it's in someone else's hands. So involved with lots of fun things that are organizations in town, and then my home is a really important part of my life.
Is there anything else about your work life in Marlboro that you'd like to mention?
Well, if anybody's interested in going into nursing, I'd be happy to talk to them. There's so many wonderful things one can do with nursing, and it's a real satisfying career for me. I can't think of anything.
Thank you very much for your time.
Thank you, Althea. It's been fun. So you have major editing.